Hello, I'm Joanna Dundon, National Clinical Informatics Lead Public at Digital Health and Care Wales. Engagement is important to DSPP, the Digital Services Patients for Public programme, because we want to make sure that the NHS Wales app that we're creating is fit for purpose for the patients and public of Wales. We're engaging in lots of different ways through a Patients and Public Assurance Group, which is made up of experts from third sector organisations, patient representative groups, and also patient experience leads throughout the NHS. And it just makes the product more real for people as they're actually going to be using it in what they need in their lives. We also have a wider group of stakeholders, so I've been doing presentations to other organisations to get people involved in user involvement and user research activities, plus also we're creating an alignment catalogue of products that are available in Wales, including the products that are available in health boards, but also with suppliers on some of the apps that they're developing as well, to see how they can be linked in with what we're developing. So one of the ways we're doing this is by developing a user involvement survey, working with KNOS, our suppliers, and their user research teams, so we can make sure that the app is fit for purpose. So they're testing a prototype, making sure that things do work and are relevant to people through our user design authority, so we're checking out the Welsh language to make sure that's right in there, and also items for sensory loss as well. As a lot of people who have sight problems or are hard of hearing, they will need the app to be functioning in different ways for them. As we're developing the prototype in very quick, agile ways, we have about 2 weeks to get things developed by the developers, and within that time then we call people in to test the look and feel of the app, and then that's then built into the further developments of the app. I think it's very important that we make sure that we get the patient's experience. There may be lots of different reasons why you want to use the app. You could have a long-term condition or a disability, so you're going to be using the health service more often and interacting with healthcare professionals more. But then you might also be a carer for a person or a child, so you'll need to know when their appointments are and what care they need, as well as maybe you're a well person, but you want to just double check on your immunisations and vaccinations, so if you're going to be travelling abroad. So there are lots of different reasons why you want to use the app. I think from personal experiences that people have had, it just makes it more real for people, so when you're actually using the app, you can remember that people have been testing this with all those different conditions, so they can actually understand why this is really important to people in Wales. I love hearing patient stories, and that brings to life exactly why we're here, to make sure that this is an app for everyone in Wales.